There are certain patients who etch into the granite of your soul. Such was the case with Sarah, a made-up patient, but a composite. I was a lowly psychiatric resident working in the hospital, and she was assigned to me. The information I was given: Sarah was 31 years old. She was very, very manic. She has 6 kids, and she was refusing her medications. So I met with her, and sure enough, she started telling me all about herself. She told me that she danced with the Native Americans out in South Dakota. She told me that she loves Scrabble and she wins every time. And she told me that she's heading to England soon to meet the Queen and to have some tea. Now, of course, I knew the textbook definition of what was going on. Her words coming out nonstop, rambling, pressured. She was grandiose. There was flight of ideas, nonstop, high energy, mania. She then turned to me and she said, okay, you're the doctor. You're the young doctor, huh? And she said, do you believe in God? I was struck by that question, sort of thrown off guard. Most patients would ask immediately about when they could get out of the hospital. So I said to her, yes, I do. And she said, good. I'm glad you believe in God, because God loves me the way I am, and the last thing I'm going to do is put a bunch of pills in my mouth. She declared, I am not broken. As I got to know Sarah, I found out that she grew up in a very wonderful, tight-knit family. She was the youngest girl with 5 older sisters. Her father, wanting to finally have a boy, cried when she was born, and she knew about this. When she got older, that pain lived deep inside of her. So she became a tomboy, became incredibly athletic, climbing trees faster than all the other boys. When she went off to college, she met a man, or saw a man, giving a political speech, and she determined right then and there that she was going to marry him. And so, sure enough, she orchestrated events so she could meet him, and indeed, they did get married. By the age of 29, Sarah had 6 children. She called them my own little symphony, how she loved being a mother. But then 2 years after her 6th child was born, things somehow began to shift. She started having sleepless nights. She started getting very impulsive. She went out on spending sprees, buying 30 colored towels and 5 chess sets. She began to think that people were watching her, talking about feeling paranoid. She started yelling at her husband and her kids for no real reason. Finally, her husband, he had had enough. He was very concerned, and he brought her to the hospital emergency room, and she agreed to sign herself in. She said, just to prove to everybody that she really was okay. And so I presented her case to the attending psychiatrist, and he said, she's floridly manic. We need to give her lithium to stabilize her. Presented her the lithium, and sure enough, Sarah refused. She said, I'm not going to take any meds. These doctors, none of you know better than God. Doctors 2 years ago tried to sterilize me. Can you imagine that? She said. She said, I don't trust any of them. And she turned to me and said, I don't even think I trust you. Then she went on a hunger strike. She simply stopped eating. They would bring her her meds. She wouldn't take them. They would bring her her food. She wouldn't eat it. She said, I'm not going to eat anything until you stop bringing those medications to me. This went on for 3 days straight. As a fresh psychiatrist, I was wrestling with what was going on. I knew the risks of untreated mania, but at the same time, Sarah wasn't violent. She wasn't out of control. In fact, as the days went on, she seemed to be doing a little bit better. To me, Sarah was crying out to all of us, saying, look at me, look at the real me, not my diagnosis, but me. After 3 days of this standoff, the attending physician, he finally said, she wins. Enough is enough. In fact, she seems to be doing a little bit better. We're going to let her go home, as long as she follows up with you, Dr. Gooderson. She turned to everybody and said, see, I'm okay. And her husband came and he picked her up. I did follow with her over many, many years in my office. She did have a couple more of these manic episodes, about one every decade. But she didn't ever want medications, and I wasn't going to have her or make her or tell her that she should take medications. We got to know each other. We talked about parenting. We talked about faith. We talked about the soul. We talked about the meaning of life. As the years went on, she actually went and got a PhD in linguistics. And she said to me, words matter. And then I got a call from one of her children who told me that Sarah had suddenly passed away. She had had an aneurysm, a ruptured aneurysm, and she passed away quite quickly. Her child told me that one of Sarah's requests was that I attend the funeral. And so I did. At the funeral, there was huge numbers of family, friends, children, grandchildren. So many people had been touched by Sarah. Her children got up and spoke. They said, my mom, she always had a twinkle in her eye. Others said she made us feel like we were magical. Another one said, the granddaughter said, she was great, and she had a bumper sticker on her car that said, Foxy Grandma. And then the youngest daughter got up and she said, my mom, she never lost a game of Scrabble. She always seemed to know a word that we didn't know. We laughed and we cried. There was something very holy floating in the air. And so I left that funeral with a profound sense of reverence. Sarah, she was not a typical patient. She wasn't a typical anything. Her spirit was like a river after the thaw, uncontainable, sometimes dangerous, but always alive, fiercely alive. Now, most people with bipolar disorder, they do need the traditional treatment that psychiatry offers, which usually is medication. But not Sarah, clearly. She beat her own drummer. She questioned everything. She danced. She learned. She would not let her illness define her. And as for me, her psychiatrist, well, she taught me that healing is not always about compliance. And that my role, the role of a psychiatrist, is not to conquer a patient's will, but rather to help them to harmonize their life with their body and their soul.